Hello.
Hi.
We're here at Circle of Wellness, and we have a patient of ours here that is going to be part of our MonaLisa trial, and I'm just going to let her tell her story as to why. So, Laura, can you start us from the beginning, because I know you have a very lengthy history and background with, the gynecological issues that you're having. So go ahead. She has quite the story, guys. Listen up.
Well, it all started, I come to Audrey for other services, and I was kind of complaining to Audrey that I was having some issues, and she recommended that you guys had started the MonaLisa, and I started looking into it, and I have had problems, unfortunately, with UTIs since I was a young teenager, 13, 14 years old, that it doesn't matter what happens. It's whether it's a pH balance of a lotion changing, if I don't wear cotton underwear, if anything can change it, and I've had issues with that for a very, very long time. I have seen multiple doctors. I'm on a vitamin supplement to keep those away. I have special washes that I use every day. I use a boric acid suppository multiple times a week, and trying to keep the UTIs away. And as I've gotten older, the UTIs will come, and it's no matter what issues I've got in my life, it can come from stress or being dehydrated. It really doesn't matter.
I was going to ask, do they know why you have these UTIs?
No, not necessarily. It's just something that I'm just more sensitive to a lot of things. But it's caused a lot of issues as well, because I've had them. And I mean, when I was younger, it was 6 or 7 times a year. And as I got older, it started to go down a little bit, which is why they won't put me on a constant antibacterial antibiotic. They won't put me on an antibiotic all the time because that causes a lot of issues as well.
Yeah.
So you don't want to do that. And so now that I get them about 4 times a year, they're like, no, we can keep them under control. But still, that's 4 times a year that I'll get one and have that completely ruined your life for a little while.
It takes like what, a month or 2 to get past that, it sounds like.
But yeah, it takes a few days for sure to get past the real pain, and then unfortunately the UTIs medication usually causes me a yeast infection, and then the yeast infection comes and causes problems after that. So I've had a lot of issues with that, and the doctors just know at this point, like when I call and go, yeah, that medication you gave me, that gave me another yeast infection, you're gonna have to send in another thing, and it's just
round and round we go.
Exactly. And so I'm
years and years of this.
Yeah, I'm 20 years into this of dealing with it, and unfortunately, if you research or have a lot of UTIs, unfortunately, it does affect your bladder as well.
Yes.
And so it actually makes the urethra bigger, and so there's not as much to control.
Yeah.
And so I have a lot of urgency, just the same as I would if I've got a UTI, but that happens all the time, and I have problems holding it during that urgency. And so different things like that can cause me some major issues as well.
Wow. That's just amazing. The amount of issues that compile after years and years and years of it.
Yeah.
We're trying to reach even a younger generation now to try to help them when these issues start. As we interview more and more women, we're finding out that it just didn't happen with age. A lot of this is happening at adolescence, at young women's age, even teen ages. That we can actually just treat with even our radio frequency, our temperature vitalia for the younger, and then now that you have more aggressive procedure would be the MonaLisa.
Yeah.
So just for anyone who may have daughters or granddaughters, or even if you're younger and you're suffering from these issues, we can head it off with a less invasive procedure called the Vitalia. The MonaLisa is pretty aggressive, it's ablative. So we do ablate the inside of the vaginal wall once it's been around for a while. So what other issues are you having too?
I mean, it's just, to me, it's more of these things that they control my life. I mean, if you were to look in my purse right now, there are 6 different medications, depending on what feelings I have coming on, and that can disrupt my life. I mean, at that point, if I start
intimacy,
getting yes, for sure,
the pH imbalances that come from year after year after year, month after month of medications and imbalances.
Exactly.
Yeah.
And if my pH isn't right, I can be drier. That's
Mhm.
never a fun scenario, and it doesn't make the guy feel good either. So
Yeah.
unfortunately.
And you know, women, we have to feel sexy to be intimate, and that's hard to do if we're just always fighting these issues that we have. So
Exactly.
the MonaLisa is fabulous to reset the pH balance in the vaginal wall, which then creates an ability for it to start to heal itself internally, for those areas that it controls, like the bladder and pH balances and dryness, and if you still have your menstrual, things like that. So, and also pelvic floor issues, intimacy issues, anything like that.
Yeah.
So
I'm very hopeful that Audrey was right, that hopefully this will work, and I can take a breather a little bit, and not have to have those things with me, not have to worry. I mean, I can wake up at 4 o'clock in the morning with some symptoms, and by 7 a.m. I'm peeing straight blood because that UTI is on there so strong, and then it
comes on quick too. So your body, and it's probably hard too because your body has had it so many times, it just reacts. It takes on full speed right away.
It does.
Instead of coming on gradual, which would be for the normal person. For a UTI, someone would be like, oh, something's going on with my body, but yours is just like like that.
Yeah, just like that. And it's terrible because you wake up and go, how am I going to get to the doctor?
Yeah.
How am I going to get to the doctor before work? How do I do this? I gotta get fit that in on lunch, whatever it may be.
Yeah.
And
there's the other issue. How many jobs have you lost or almost lost or been wrote up for time lost at time off or sickness? And then you go to work and you don't feel well because you don't want to lose your job.
Right.
And then how much money have you paid in medical?
You don't want to see my medical bills.
Exactly. This procedure, even though for the trial, we're using her to do the trial, but the procedure itself is only like $800, starting at $800 for a single treatment. Most people would pay, I mean, you probably have paid $8,000 a year in care still have the same problems.
Yeah, I mean, I can guarantee in my purse there's $50 worth of medication just to try to any little symptom or anything.
Like on it.
Yeah, exactly. I get sent stuff in the mail that if I have sex, I'm automatically going to be drinking this. If I
so it triggers an imbalance. I think that's definitely where the MonaLisa is going to help you.
Yeah. Is
with that, getting that area to realize we can be rebalanced. The pH balance will help calm it down a little bit and be like, oh, you know what? We're going to renew that area.
Yeah, I'm really excited to see it work.
I'm excited too. All right, guys. So we are doing her first treatment next week. So tune in, and we will have her tell us all about it afterwards. And then we'll be able to touch base with her every week after that to kind of check in her healing process, any symptoms that she's noticed that have subsided, things that have gotten for the better.
Yeah.
And then we hope to set up a second one with her as well, because generally how it works for someone who has multiple issues is it could take 2 to 3 times. Someone who has like 1 or 2 issues, it could take one time to help resolve those issues. But hopefully it's a one and done. But hey, I'm there for the long haul. We want to get her better.
Me too.
So
thank you.
We'll see you guys soon. Yeah.